So good afternoon, everybody. Today is April 30th, 2021. My name's Scott McGann with the Falmouth Health Department. We're doing our weekly COVID-19 update. Our phone number is 508-495-7485. That's not to schedule an appointment, but any COVID-related questions, you can call us. Our email is health@falmouthma.gov. The county COVID hotline, if you had questions as well, 774-330-3001. As of last week or so, individuals over the age of 16 are eligible. So anybody over the age of 16 can get vaccinated, and there's plenty of opportunities. So let's get started with that part. Starting with our website. Okay, we have two links. I put big red arrows showing. We'll start off with the one that goes, it says pre-register for a COVID-19 vaccine appointment. So any Barnstable County clinic, which right now will be primarily the 4 Cs, I'll explain that in a minute, or any of the state sites, you would just do a pre-registration and you'll be contacted. So it's not like everybody waiting till noontime on Friday to jump on the computer to get an appointment. That ship has sailed, thank goodness. So you can pre-register that way through mass.gov. So that would get you a county clinic and would also get you a clinic at any of the state mass vac sites. And then the vertical arrow that says community health centers, you click here, that's going to be directly with them. And I'll explain why it's working this way now, okay? So the pre-registration is pretty simple. To come to this site, if you click on the vaccine appointment, it looks like this picture here, shows you the sites. You put in your information, and it'll email you, and you'll have 24 hours to decide. So pretty simple. Pharmacies, you would still go on the COVID availability or directly to their site. So the pharmacies still vaccinate, but they get federal doses, so they have their own individual systems. CVS does great, Walgreens, they all do a good job. The grocery stores as well that have pharmacies. So all the clinics here on the Cape, all the blue ones indicate a pharmacy. The ones I've circled indicate the ones that are originally being run by Barnstable County. So in purple was the main one, that's 4 Cs. The one in red is the fairgrounds, and the one in gray is the Orleans DPW. So Barnstable County Health is getting the standard $3,500 to $4,000 a week. They're going to be doing those primarily out of the purple or the 4 Cs. Okay. The biggest increases are going, because they're getting federal and state, to the community health centers. So instead of trying to bring Barnstable County back and forth, most of the time what's going to happen is the Community Health Center of Cape Cod, they can use other sites, like today they're doing one at the Cape Cod Church across the street from the fairgrounds, because at the fairgrounds we're doing a second dose clinic for them when we did 21 days earlier. That's being done by Barnstable County. So they'll be so most of the vaccinations coming out of the fairgrounds now will be the Community Health Center. It won't look any different. It'll still be the same. Barnstable County and the systems that we have with the police chiefs and the fire chiefs for details, and the volunteer systems with our local community emergency response team here in Falmouth, which have done a great job, and also the Barnstable County CERT team. We know exactly, everybody has their own defined roles. They show up and they do it. So the outside of that barn will be the same. Inside, the vaccine will come from the Community Health Center. And with the MRC, the Medical Reserve Corps, and the Community Health Center, they'll be doing the clinics instead of having Barnstable County nurses come down to do it. And primarily it's because they're getting a large amount of doses. The same is going to happen with the Outer Cape, with Outer Cape Health. They're getting a lot of doses, so they're basically taking over and vaccinating out of the Orleans DPW. Cape Cod Healthcare has been doing some out of the Melody tent, just because the 4 Cs was getting tight on parking when both the county and Cape Cod Healthcare. Now, the one thing I want to tell you is vaccine supply, it looks like it's appearing to outpace demand, meaning yesterday's clinic being run by the Community Health Center of Cape Cod at the fairgrounds was open. We had about 300 appointments, had many hundred more doses available. So it should be relatively easy for you to get a vaccine, either by pre-registering or coming over to, I'll show that website here in a second. So if you went on to the Community Health Center, this was yesterday's, I believe, or maybe the day before, but I cut and paste this, it shows here. Just click here to schedule a vaccine at the fairgrounds. Click here to schedule one today at Christ the King. If you click on this today, there may be appointments available. I think they end the clinic maybe sometime around 2 or 3, but they're not filling these clinics. So there's plenty of opportunity to come to the clinics, and then when they get new ones, so next week there'll be 2 more blue bars with some more dates. And so there's plenty of opportunities to get vaccinated. The community health center getting more doses, being close to here, they're out of Mashpee, is your best bet. Again, pharmacies still, and so forth. So there's plenty of opportunities. I thought the bottleneck would take a little bit longer to loosen up, but right now it looks like we're definitely able to keep up with the pace, unlike we were probably several weeks to a couple months ago. The Regional Vaccine Consortium still have the process. If you're homebound, you should be calling the senior center. If you know someone who's homebound, hasn't been vaccinated, call the senior center. We'll do the reach out. We're trying to get everybody that we know and is identified and contact us as homebound has been vaccinated already. So the community health center is taking care of that for us, thanks. And so we've been finding those individuals and referring them over to the community health center. They've been bringing the nurses out, the vaccinators. If you're going to have difficulty to getting any of these clinics or registering online, again, call the senior center. We can help you. They can help you. Second dose appointments, I left that up. You shouldn't be having trouble getting second dose appointments at this point, but you could call the health department. We could refer you over. You can call the senior center. Or usually you get automatically scheduled for that, but at the beginning of this, it was a little bit tricky, but that opportunity is still there if you're struggling for a second dose. So where are we in terms of vaccinations? First doses, we're at 64% for the county, up 5%. For fully vaccinated, we're at 47, which is a 6% increase from last week. In Falmouth, we have 65% with first doses, so we know we're going to have at least 65 or two-thirds of the town roughly vaccinated within a couple of weeks. Even though we're at 47% fully vaccinated, the ones that have had the first shot will get the second shot, and then it's going to be at least 65. So the total number of first doses was a little over 20,000, and fully vaccinated is 14,800. You see with 75 being 95% done. You see the biggest increase among those 64 and less, but generally those under 50, because they're more recent, you see the biggest increase. You're seeing 8% increases week to week in the number of vaccines given out, so more percentage of the population. Hopefully those numbers continue like that. The maximum we could get vaccinated is somewhere around 86% because it's not eligible for 0 to 16 years. So let's say 86% is our max. Right now we know we're going to get to about 66% at the minimum. So it's the time frame over the next few weeks, we hope to get into the mid or upper 70s. We like to get everyone vaccinated, but not everybody's going to take the shot. But right now, so we're about two-thirds, and we need to be the theoretical maximum being somewhere around 86%. So I'd like to see another 5 or 6, 8,000 shots done, and that get us right up in there. So that's where we are for this week. As far as cases, we've had a fairly good week compared to some of the past weeks we've had. Our total case count is 1,522 with a 22 case increase from last week, 15 rapid antigen tests. The state has said about 30% of all cases in the state is the B117 variant. It does spread more rapidly. We are seeing that once it happens in a household, it tends to hit more people in the household than I guess the regular or the one that we're used to, COVID. You tend to see the increase there. So like in that 22 case count, we could have a couple of families with 4 or 5 cases, and that could be it. But in terms of, cases showing up from a different household, those have definitely on the downward trend, no doubt about it. Okay, so that's where we are with cases. Let me show you what the chart looks like real quick. You can see that the 4-week downward trend. Hopefully that continues, and within a couple of weeks, we're down into what we were last summer in the 4 or 5 range and lower. Vaccinations are going up, cases are going down. That's true everywhere, so that's a great sign. So that's where we are with our weekly case count. Again, the curve is starting to flatten. You want to see this line flatten. You can see it went up a lot over in that late March, early April, but it's definitely showing it's starting to flatten out, and that's what we want to see. So for this week, our positivity went up slightly. And part of it's being because we've had, several household clusters being on the larger side, but our case count remains in that 20 to 30 or so range. You got to remember that also this is also collected 2 weeks prior to the 24th, so it's slightly old on the data. We did have higher case counts earlier, so it's still picking up some of the case counts from the higher weeks that we had. But we did have, so we're at 3.54. The state's at 2. So the county in general is higher. It's been very high. It was the highest, but the county is coming down. More and more towns, you can see, the only town on the Cape now is Yarmouth. So that Mid-Cape outbreak is working its way down. It just takes time. So now they're down to the county at 3.4, down from 4.34, which was high, it was higher, well above 6 for a little while. So we're starting to come back down into the state range. As long as we don't have any outbreaks, the vaccinations continue, then we should be able to get down to where the state is. Because most of the outbreak of the pandemic, we've been lower than the state average. It's just been more recent with the outbreak in the Mid-Cape that we've been higher than the state. And to show improvement on the left, you can see I just randomly put a bar at 30 per 100,000. You can see that we had some towns close and a couple over, and you can see that every town is now less than 30 because you see the reduction in cases basically week to week, because on the right you see nobody crossed that particular line. Case counts, you can see them going down significantly from the late March, early April, and that 297, 281. Now we're in that 85, 51, so only in a few weeks it's down to there. Give it a few more weeks. If everything works out, then we could be really, really low. Hospitalizations are on the lower side. Again, high in that late March. We get 30 cases at Cape Cod Hospital, 32. 30 cases, 16. Now we're in that 7 and 3, so that's better. It mimics what cases are doing. Also, the vaccines have been shown really effective against hospitalizations, even among the elderly. So that's, again, a great sign. That's what's keeping hospitalizations down. Age-wise, in cases, you can see it in Falmouth as well. Our average age is much lower over the last couple of months than it was throughout the pandemic. I think our average was around 48, our average age of all cases. And now over the last couple of months, it's been in the mid-30s. So you're seeing the younger population getting more of the cases, especially that 20 to 29, and seeing much less cases among a higher percentage of the population over 60s vaccinated, and there you go. So we've been averaging sort of 800 to 1,300 cases per day. It's been a relatively quick turnaround with tests, about a day and a half. Positivity is now, at least for this particular time frame, was down to 1.6. Deaths are down, definitely under 20, some days under 10. Again, all indicating less cases, less problems with hospitalizations, less problems and less deaths. So, again, another good trend. All these bars that show you, all the graphs that show you can see everything dropping, the positivity, the deaths coming down, cases coming down, and benefit of getting vaccinated. COVID testing hasn't changed. You can do a free one through the Barnstable County Fairgrounds. Your convenient MDs, your CVSs are still doing it. Falmouth Hospital is still doing it through your physician. They call the call center. So nothing's changed on testing. Updates on guidance. That was a big change for this week. So starting the 10th, large venues can go from 12 to 25%. That's like, Fenway, Gillette. Some amusement parks, theme parks, outdoor water parks will be permitted to operate at a 50% capacity after they submit a safety plan. Big for us, road races and other large organized amateur and professional sports will be permitted to take place with staggered starts after submitting safety plans to the local Board of Health. Youth and amateur sports tournaments will be allowed for moderate and high-risk sports. Singing will also be permitted indoors. Now, at 29th, your gatherings limits, based on data, so again, this isn't solid until they see the cases continue to drop, will increase gatherings to 200 people indoors, 250 out. You'll be able to do street festivals, parades, agricultural festivals at 50% of their capacity. So the fairgrounds of the Barnstable County Fair would be able to be at 50%. Bars, beer gardens, breweries, wineries, and distilleries will be subject to restaurant rules with seating service only and a 90-minute limit, no dance floor. Again, so there's, and table size can go to 10. So that's some of the changes on the 29th, again, as long as things go well. August 1st, we're pretty much open, and I have bolded out, all industry restrictions are hoping over by August 1st, the capacity to 100%. Again, depends on the cases, depends what happens, So that's good news. So things are opening back up. as far as what's safe with, you can get this on the state's website as well. So we've been fully vaccinated. Only indoors would be wearing masks still. Outdoors, you really don't need to. And things are all relatively safe. You can see them all in green. Green means whether it's a safe activity or not, and it shows the individual picture with the masks. And you can see unvaccinated people, masks only not if you're walking, running, or biking outdoors with members of your household, attending a small outdoor gathering with fully vaccinated friends and family. All the times they are asking you to wear masks, with the more indoor activities being the highest risk. Again, stick with the mask, stick with the glove, stick with the hand washing, sanitizing, travel if you have not been vaccinated. You could still, if you're with a bunch of unvaccinated people, gatherings indoors without social distancing can still spread COVID. I mean, we still are getting cases, so things can still happen. So it's not over yet. So again, keep on with the diligence. So as a recap, everybody over 16 is eligible. Falmouth residents' vaccine rates are similar to other Cape towns, with the Cape being higher than most. It's definitely more than Bristol or Plymouth County. Plenty of vaccine available. Take advantage of it. Okay, we just told you how to do it. You can also, if you're having trouble after my talk, you can always call me at the health department. Call the health department. We can walk you through it as well. State metrics are showing a decline in cases and a decrease in serious illness. Barnstable County, our rates have improved. We're still higher than the state, but we have improved. And for Falmouth, we're at a 4-week downward trend. So that's my update for the week. So it's good news. Plenty of vaccine available, and our cases are dropping. That's the things that we wanted to see. And the vaccine availability has happened at a much sooner than I thought. I thought maybe by mid to late May, the bottleneck would free up and everybody would have a chance. But you really do. If you want a shot, there's no reason why you couldn't get one by early next week or midweek next week. There's really you really have an opportunity to get one, and we really want you to take advantage of it. And so that's my update for the week. Thanks.